What are the issues that you see of greatest importance for Medicare Shared Savings Program MSSP participants in the 2024 proposed rule?
Great question, Colin. I think the changes proposed to the Medicare Shared Savings Program, the quality reporting side of that particularly, is the biggest change and the biggest impact of this proposed rule. Despite heavy lobbying by the National Association of Accountable Care Organizations, that's NACOS, and by individual ACOs, CMS is stubbornly refusing to postpone the 2025 scheduled sunset of web interface quality reporting. Instead, they propose to offer a new quality measure collection type they're proposing to call Medicare CQMs. That's Medicare Clinical Quality Measures. It's the same three-measure APP measure set we've been seeing right along: hemoglobin A1C, blood pressure control, and depression screening and action if it's positive. This proposed Medicare CQM uses the same numerator specs of the existing MIPS CQMs. In fact, it's the same collection mechanism. The dynamics are the same as the MIPS CQMs. The denominator, however, they're proposing to limit to just Medicare patients. Now, it's very similar to what we experienced in those days of the Physician Quality Reporting System, or PQRS, with a little difference. The Medicare, they propose it will only be Medicare patients. But even with that, it's only the Medicare patients in the practice that have been seen by a primary care provider in the expanded list of providers who could be delivering primary care. So, and it's not like current web interface reporting. It's not attributed patients, it's patients seen. Now, overall, it's intended to reduce the burden on the practices. It's intended to be a temporary measure as we transition and learn about the APP, learn about broader reporting, not just to that small web interface patient set, and to help us learn how to deduplicate and aggregate our data across practices. Their intention is to provide a list of Medicare patients early in the first quarter of every year during the submission period for the prior year's performance reporting. They warn us also we can't count on that list because it will be incomplete. Typically, Medicare patient lists represent, there's a quarter lag between the claims generation and the list being prepared. So it will include only through the third quarter patient experience. So it's only intended to be a help to identify your patients and deduplicate, but it's not a complete list. And they emphasize that they're still requiring that 100% of the eligible patients be identified, even though we do have that data completeness limitation that we only need to report on 75% of the numerator eligible patients. The second thing to pay attention to in the proposed rule is a proposal to change the certified EHR requirement for advanced APM participants from 75% to 100%, essentially requiring all participants in the APM to have certified EHR. They're also proposing to make a requirement that all advanced APM participants now be required to make a promoting interoperability submission within the MIPS program, and that each of the participants in the APM have a MIPS PI score. Now, all the methods of reporting are still open. That is individual reporting, practice level reporting, and APM level reporting. So all those requirements are still, all those options are still available to you. You're still subject to those exclusions for small practice and non-patient facing. So those are still there, but except for those exceptions, all are expected to have a MIPS PI score. So in review of all of these, look them over. If you need to make comment if you have input to Medicare, and let's wait for the final rule. Watch it carefully when it comes out in the first days of November.